What happens to me when I have COPD? COPD stands for Chronic Obstructive Pulmonary Disease, a disease of the lungs, the organ through which we breathe. It is a long-term disease which obstructs, that is, partially blocks the airways of the lungs. First, let's understand the normal breathing process. Breathing starts with an intake of air from the nose and the mouth into the windpipe called trachea. The windpipe splits into two breathing tubes, the bronchi. The bronchi continue to divide into smaller and smaller tubes called bronchioles, which take air down into each lung. At the end of the bronchioles are the air sacs called alveoli. The exchanges of gases take place at the alveoli. The inhaled oxygen is transferred from the air sacs into the blood, and carbon dioxide, the waste product from the blood, gets into the air sacs and gets exhaled through the breathing tubes. In COPD, what happens inside my lungs? Now let's understand what happens inside the lungs in COPD. In COPD, there is a constant swelling of the airways, the bronchi, resulting in increased production of a thick fluid called sputum. The swelling of bronchi is called bronchitis, and since it is long-term, it is called chronic bronchitis. Excessive sputum production causes the inside of the breathing tubes to be narrower than usual. As the breathing tubes or airways become narrower, it is harder for air to move in and out of the lungs, resulting in breathlessness. In some cases of COPD, there is a marked enlargement of the lungs, which are evident on a chest X-ray. This condition is called emphysema. In emphysema, the air sacs become swollen or bloated, and the walls between them break down, causing larger air spaces. The lungs lose their flexibility, and it becomes harder to breathe air out.